Hello and welcome to our latest video on testosterone replacement therapy. Today we're looking at whether TRT can help to build muscle in men. You probably already know that testosterone is a potent muscle building compound. Bodybuilders and athletes use it to increase their muscle mass and strength. In fact, the higher the concentration in the body, the more muscle is produced. That's why top bodybuilders take a lot of testosterone. Your average steroid cycle is about 500 milligrams per week. That is more than 5 times as much as the average man produces. Top bodybuilders can take from 1500 milligrams per week. So, how does this convert to testosterone replacement therapy? Does it have the same effect on muscle building? The first thing to say is that the primary goal of TRT is not to increase muscle size. It should be used to improve symptoms of low testosterone, one of which can be reduced muscle mass, but this isn't usually the only symptom that men experience. However, increasing muscle mass whilst being on TRT is a really nice side effect or benefit when you start. When I started TRT, my muscle mass increased a lot, and I went from about 93 kilograms to about 96 kilograms over the course of 6 months. I also lost a bit of body fat during that period. A lot of men notice that when they have low testosterone, their muscle mass has decreased and their strength with it. This may be combined with an increase in body fat, which is not good. Having reduced muscle mass and increased body fat normally makes people feel worse, increases your chances of having insulin resistance, which can lead to diabetes and other health conditions in the long term. When I worked in hospital, I used to see a lot of elderly men and women whose main issues all stemmed from the fact that they were weak and had low muscle mass. This caused them to fall over and break their bones, and they then couldn't recover effectively and get back to walking. People over 80 who break a hip have a 50% chance of dying in the first year after the injury. So it's kind of a big issue. Almost all of these people probably have low testosterone, low bone density, and low muscle mass. So is there any evidence for this? There are several studies that show that testosterone increases muscle growth. There are also studies which show that testosterone replacement therapy increases muscle growth in men who had low testosterone. Most men on TRT end up with top of the normal range testosterone level. This means that you're increasing your testosterone about 2 or 3 times over what it was before you started treatment. This results in muscle mass increases. You can take a little look below at some of those studies if you want to read up on some of the evidence behind it. So how should I train for muscle mass whilst on TRT? It's pretty much the same as you'd be training usually for muscle mass. You want to aim for compound lifts such as squats, deadlifts, bench press and overhead press. And you want to make sure you have a decent amount of volume in your workout. Using the compound lifts allows you to increase the weights and increase your intensity in an effective way. If you want to, you can also add in isolation movements to improve the amount of volume that you're getting per workout. This has a different effect on the muscle fibers and can help to increase the muscle growth. The other really important part to this is getting enough sleep and also getting enough calories and protein in particular. You want to aim for about 250 to 500 calories extra per day. If you want to learn more about this, then please take a look at the article which is in the link below. If you enjoyed this video, please subscribe and click the like button. Thanks for watching.